Hello, good morning. Hi, everyone. Welcome back to the channel. I'm Dr. PK, internal medicine physician, and your guide to better understanding of your health. Today's topic is something very common yet often misunderstood: the leg swelling, also known medically as peripheral edema. If you have noticed your legs, ankles, or feet swelling up, this video is for you. Let's talk about what it means, what causes it, and how we investigate and treat it. Don't forget to like, share, and subscribe. So, first thing first, leg swelling simply refers to fluid buildup in the tissues of your lower extremities. It may be mild and temporary or severe and persistent. It can happen on one leg or both legs, and distinction is very important for sake of diagnosis. So let's break it down. If you have unilateral swelling, one leg only, it often suggests that the problem is local. Means you can have deep vein thrombosis, which is clotting in your vein of your legs, cellulitis or infection, or lymphedema, which is collection of lymphatic fluid because of some obstruction and some disease process. Could be trauma, could be injury. Bilateral swelling of both legs. Typically, it suggests that problem is systemic. So it could be related to congestive heart failure, kidney disease, liver disease like a cirrhosis, chronic venous insufficiency, we call them varicose veins, and some medications like amlodipine and common pain medication called NSAIDs like ibuprofen, naproxen, etc. So let's go deeper and break down the top causes based on location, severity, and symptoms. So we call it differential diagnosis of leg swelling. Number one, deep vein thrombosis (DVT). Usually, it's one leg. It's painful, tender. You have redness and warmth. What are the risk factors for that to happen? Recent surgery, cancer, immobility, estrogen therapy. What I've seen, sometimes people even the long ride to some long distance traveling, and they didn't have enough chance to get out and walk around, and lack of hydration leading to clotting in the veins. Sometimes I've seen patient even after the long flight developed DVT. And the high risk is potential for pulmonary embolism, which is when the clot breaks apart from the leg vein and migrate to the lung, causing pulmonary embolism. That can be fatal depending on how severe it is. Congestive heart failure, usually bilateral, both legs are affected, is edema, swelling, pitting. If you press it for on the skin for 15-20 seconds, you'll see the dipping, and that's pitting edema. It's often worse in the evening and associated with shortness of breath, fatigue, and orthopnea. Orthopnea is something when people have short of breath when they're laying down. Heart cannot pump blood efficiently, so fluid backs up. Liver cirrhosis. Liver cirrhosis causes low albumin in your body because albumin is produced, which is a protein, is produced by liver, and low albumin causes a drop of pressure in the vein. We call it oncotic pressure, and that leads to seepage of fluid from the vein to the tissue, causing edema, and it's associated with ascites and jaundice. Kidney disease, nephrotic syndrome, causes massive amount of protein loss in the urine and leads to puffy face and leg swelling. Your urine is to be checked, creatinine and GFR, which is glomerular filtration rate, needs to be checked by a doctor. Chronic venous insufficiency. There are lots of people with a vein problem, varicosities, because of the damaged valve in the veins, and that leads to poor return of blood, and blood stagnates into the most dependent part of your legs because of gravity, and it's worse after long standing. It leads to skin changes because of seepage of blood in the tissue, and that blood breakdown leads to formation of a pigment called hemosiderin, and that causes a staining of the skin, and it can also lead to ulceration. Lymphedema. Lymphedema, where there's an obstruction of lymphatic channels that causes non-pitting and chronic swelling. We see that often after cancer treatment or lymph node removal in the armpit with a female, usually with the breast cancer issues. They have a lymphedema of upper extremity. And though the skin gets thickened because of chronic fluid accumulation and hypertrophy of subcutaneous tissue. Medication induced calcium channel blocker like amlodipine, a blood pressure medicine we use often lead to about 15% of patient edema of the lower extremity. Common pain medication, ibuprofen, naproxen can cause also edema of the legs. Steroid, prednisone can cause also accumulation of fluid in your extremities. Hormones like estrogen can cause edema as well. So let's say you show up to a clinic with swollen legs. Then what do we do? So, we obtain history and physical. We ask you a question for how long, onset, duration, one leg or both leg. Ask if you have fever, pain, shortness of breath, any medication, recent travel, surgery. Then we order some blood test on you, complete blood count, basic metabolic panel to check the kidney function, liver panel to check your albumin and enzyme, BNP, which is heart failure marker, beta natriuretic peptide. We check urine for protein for nephrotic syndrome, and we check D-dimer if we are suspicious of DVT. We ordered some imaging studies as well, like venous Doppler ultrasound for deep venous thrombosis called DVT, or an echocardiogram to check your heart function, and chest X-ray to check your heart size and fluid in the lungs. And if we feel that there may be unilateral edema and there may be obstruction of lymphatic channels or vein, then we order CT or MRI of lower extremity or abdomen or pelvis. So how do we treat them? Now, for the most important part, how do we treat the leg swelling? So it depends upon what's causing it. So heart failure, if that's the reason you're having edema, then we need to make sure that we give you a water pill called furosemide to get rid of extra water, manage your blood pressure, fluid and sodium restriction, and treat the underlying heart disease. Kidney disease, we treat them with a diuretics, which is a water pill, Lasix usually, and then we treat the cause. And we also use a medication called ACE inhibitor like lisinopril, benazepril, captopril to reduce protein excretion in the urine, and we send you to see a specialist. And if you have DVT, deep venous thrombosis, we put you on anticoagulant called heparin, apixaban, similar medication, sometimes even coumadin if insurance is not covering it. And we monitor for you for pulmonary embolism. We also want to make sure that you don't have some issue with the special protein called CNS, which can cause increased propensity for coagulant, increased propensity for clotting. Liver disease, we usually give you diuretics and salt restriction and manage cirrhosis complication. For venous insufficiency, compression stockings, elevate your legs, exercise. For lymphedema, lymphatic drainage manually, compression therapy, and avoid infection. And if it's because of medication like amlodipine or NSAID, we stop them. So other things you can do: elevate your leg, walk frequently, compression stocking, limit your salt, stay hydrated. So if your leg swelling is new, severe, painful, associated with the breathing issues, don't wait, get help. And if you found this helpful, hit the like button and subscribe to my channel for more health updates. And thank you for watching. Have a great day.